Hi, everybody. There's been a lot of talk recently about COVID super spreader events. What kind of events cause these outbreaks which are driving the virus forward? And in particular, people are talking about three different things. The Sturgis motorcycle rally in South Dakota and whether it caused hundreds of thousands of new COVID cases. The Black Lives Matter protests, massive movement since the death of George Floyd this year that's caused tens of millions of people to march in the streets. Has that been spreading COVID? And finally, President Trump's rallies that are happening now around the country leading up to the election. Could those be potential super spreader events? Well, let's lay the stories out and see what we got on Apocalypse Prep. So this is a year when we've seen science get political. And that's been evident nowhere more than in this case of what has caused COVID super spreader events and what hasn't. The first question is, can a virus have a political affiliation? We had everybody at the beginning of this in March and April, epidemiologists were saying everyone needed to stay home, stay indoors. And then when the Black Lives Matter protests happened after the tragic death of George Floyd, suddenly everybody was calling epidemiologists hypocrites because a number of public health officials signed on to pledges that structural racism was also an epidemic and that they supported people going out and protested. Suddenly there were all of these calls of hypocrisy. Why isn't it hypocritical for you public health officials to tell me that I can't go out and go to a restaurant when you're allowing these folks to go out and protest? What's that all about? And so the cry was, well, is it magic? Because these are protests against racial injustice, suddenly I'm going to be safe when going to a restaurant is a danger to me? What is that logic? Where is that coming from? This came to a head over some other incidents in the summer, Trump's campaign rallies, and in particular the Sturgis motorcycle rally in August, where there was a lot of press about it and suddenly a study afterwards that rally had caused hundreds of thousands of new COVID cases, which was swept up in this whole political firestorm. People are saying, well, if you can't trust an epidemiologist to tell you when to go to a protest or not, why am I going to listen to them about things like masking or social distancing? Let's get to the bottom of it. Let's talk about these three incidents, because now we have really good data on all of them. The Sturgis motorcycle rally, the Black Lives Matter protests, and Trump's campaign rallies, and kind of dig into what caused COVID spread and what didn't, and what can we learn about it and what can we do about it. So Sturgis motorcycle rally starts the first Friday in August every year. The little town of Sturgis, South Dakota, hundreds of thousands of people went to it this year. They were expecting maybe a drop in attendance. Didn't really happen. It turned out that 365,000 or more people showed up in Sturgis starting that first Friday in August. They went to a series of indoor-outdoor concerts. There weren't a lot of masks. There were a lot of different events that were happening all over the place there. And a couple of weeks after it was over, a study came out, a study from a group of economists that said that the Sturgis rally had caused maybe 250,000 coronavirus cases around the country. This spread through news like wildfire. Everybody was kind of calling out the motorcycle rally about that. But there was a problem. And the problem was that this study was based on cell phone tracking. In fact, what they did was they kind of anonymously tracked all the folks that went to Sturgis, where they had come from, tracked those phone numbers back to the home states that had the motorcycle riders had been from, right, to go to Sturgis. And when they did that, then they looked at kind of patterns within those states or in transit and linked sort of the nearby cases to those motorcyclists. The thing that paper didn't have, kind of crucially, is a model for how the disease would actually spread from person to person. So soon after it came out, scientists at Columbia, at Johns Hopkins, at Harvard all said, you know, this is maybe theoretically possible, but it's really high. It's an intense worst case scenario, and probably it's outside of the realm of positivity. So what do we actually know about Sturgis and how it caused COVID or didn't? Well, a couple of weeks after Sturgis, we started getting contact tracing data back from South Dakota and from the other states where the rally goers had come from. Initially, there were 250 cases in 12 states that were tied back to the rally. So that's not a lot. 250 cases from 365,000. And that's true. We're not looking at hundreds of thousands of cases. But are we looking at a spike? Did something happen from Sturgis? Probably. Let me walk through the rest of the data and let's talk about it. See, right around that time, South Dakota spiked to a 17% positivity rating for coronavirus tests, which is really high. Most of the country, even places that are considered hotspots, are still at maybe 3% or 4%. So suddenly in South Dakota, a lot of people were going in for tests. A lot of them had COVID all of a sudden. And then last week we saw that cases in South Dakota substantially spiked. They spiked 166%. There were more than 8,000 new cases. And North Dakota, too, had more than 100% new case increase from the week before, with more than 4,000 new increases. And there were a lot of states in the Midwest, a lot of these same states where motorcycle goers had come from, that were reporting similar increases. And the health departments in those states were saying, yeah, it looks like a substantial number of these cases were driven by Sturgis. So 200,000 cases? No. But were there cases that came from that rally? Yeah, it looks likely, right? It looks that like there were hundreds of cases that could have come out immediately, then thousands of cases that were kind of traced back to those initials. So was it, apocalyptic super spreader? No. Was it a super spreader event? Probably. It did move the needle. So let's talk about Black Lives Matter protests. So much larger, right? 15 to 25 million people participated in these protests since the tragic death of George Floyd. It was called the largest protest movement in U.S. history, actually. That's how big it was, larger even than the civil rights protests of the 60s. And interestingly, the very same group of economists that saw this 250,000 case spike after Sturgis said, well, you know what? There are no cases associated with Black Lives Matter. So that kind of put your antenna up, right? You get a little suspicious. Economists were saying Sturgis caused 200,000 more cases. Black Lives Matter protests caused absolutely none. What's going on there? Seems like maybe there's an agenda. The thing that happened, though, is that same thing. Columbia, Johns Hopkins, Harvard, some scholars in California all also weighed in on it. But this time, all of them agreed with this group of economists, using contact tracing data, using other studies that they were doing, looking at modeling. They all agreed that the Black Lives Matter protests had not caused any kind of substantial spikes, even the kinds of spikes that we saw after Sturgis, even these kind of more limited spikes. So is it the case then that this virus just really cares whether you're doing something progressive versus whether you're going to a rally with your motorcycling friends? No. That is not what it means. Here's what the epidemiologist said were the factors at play. The Black Lives Matter protests basically were always outdoors. Remember, Sturgis was a combination of indoor and outdoor events. They were in the wind and the sun, right? That is, there was a lot of people were marching, right? So there's always a breeze, there's a lot of airflow, and people didn't share facilities, right? They weren't sharing bathrooms, they weren't sharing changing facilities, they weren't going inside to a restaurant to get snacks, even with an outside event, right? All of that makes sense. There's one other kind of crucial difference, and that's the question of intention and care. See, most of the people that were participating in the Black Lives Matter protests were taking the virus seriously. Look at the name, right? One of the main reasons for protesting, even though George Floyd had set them off, was that we were in a context where the mortality among black folk from COVID-19 was much higher than the mortality among white folk or other populations. And that is an unfair aspect of health in America, right? And the fact that black folk in general have shorter life expectancies and they have higher numbers of pre-existing conditions, mostly because they don't have access to good health care. So that frustration was pushing the protests up. And what that meant was that the people who were organizing those protests were really intentional about being careful about the virus. Masks were mandatory. They were much more widespread than they were at Sturgis. People were giving out hand sanitizer all over the place. Social distancing rules were enforced. And the most important thing is everybody there believed that COVID was happening. And was there in spite of COVID, right? They cared so much about this thing that they were protesting for, they were willing to go even though they might get coronavirus, and that meant that they were really, really careful about masking and taking care of other people. And let's remember that the reason you're wearing a mask in a crowd like that is not to protect yourself. We wear cloth face coverings because they keep viral particles near us if we're kind of sick and we don't know it. Thing about COVID is there's these 2 or 3 days where you don't feel sick, but you can spread the virus. That's when wearing a cloth face covering keeps you from giving it to other people. So a situation like Sturgis where the message is, well, you can wear a mask if you're worried, that actually doesn't make a difference, because if you're worried, you don't want yourself to be wearing a cloth face covering. You want everybody else to be wearing them because they're all protecting you by wearing a cloth face covering. So those were some of the differences. And again, those aren't political differences. Those are differences related to care and respect for the virus. So that brings us to Trump's rallies. So in the past few weeks, the Trump campaign has started up a number of campaign rallies. In Nevada and Arizona, they had indoor rallies with 4,000, 5,000 folks in them. Last week, there was a larger rally, about 10,000 people in Michigan outside of an airport. Now, it was outdoors, but just like with Sturgis, people were still sharing indoor facilities, ingress, egress, restrooms, all that kind of stuff. And crucially, although masks were given out and you could wear them if you were worried, they weren't mandatory, right? Everybody wasn't going to wear a mask. So what do we think about that? It's too early to tell from contact tracing whether cases will go up or not. If you look at Sturgis, you see how it took really almost a month for that needle to start moving. Crucially, we do have one case associated with the Michigan rally right now. But we can look at places like Sturgis and other super spreader events to say, if it's indoors and you don't have universal mask wearing, you're likely to see some cases. We had pretty good data that the Tulsa rally that Trump held indoors a few months back did cause a localized spike in cases, and that there were some deaths associated with that rally. So let's pull it together. What am I saying? So the rules about COVID are not political. It doesn't matter what kind of event you're having. They're about care and intention. Number one, if you're going to have an event, it should be outdoors and it should be distanced. Second, people should wear face coverings, not voluntarily, not wear one if you're worried. Everybody should wear them because they're all taking care of each other. I wear a mask to take care of you. You wear one to take care of me. That's where a lot of the frustrations about cloth face coverings come from, even among people who are used to wearing masks or respirators, because they hear this story, well, you're supposed to wear a piece of cloth. Well, I know my mask protocol. I know that won't keep me safe. Well, it's not supposed to. You wear the cloth face covering because it prevents you from infecting others. Just that one fact, I think, if we could get that one fact out there in a more widespread way, it would really diminish the possibility of super spreader events at all of these kind of things, left, right, or indifferent. And finally, there's this question of intention. Both at Sturgis and at Trump rallies, a lot of people are there making fun of COVID. They're mocking it. They're saying it's not a real pandemic. There's this general air of disinformation that's happening. Trump himself doesn't wear a mask. A lot of the bands at Sturgis were kind of making fun of COVID. And when you have that aura, it's going to diminish social distancing. It's going to diminish mask usage. It's going to diminish the kind of care and courtesy of taking care of each other. Black Lives Matter protests, on the other hand, we have really good scholarly data from like a bunch of research studies that have been done that people there encouraged each other to wear masks. If they weren't wearing face coverings, you would tell somebody, hey, you need to put on a face covering. Hey, here's some hand sanitizer. Hey, let's mind our social distancing. They appointed people in the crowd at protests whose job it was to mandate those practices. Again, that's not a political statement. it is a statement of care for your fellow human being based on the fact that we're in this pandemic. So as we go through this, we now have really good data on what kinds of incidents work to kind of contain the virus and which ones don't. And we know that outdoor incidents, outdoor protests, can be done safely if you follow care and consideration for the virus. So any event that you're holding this campaign season as we move towards a really contested election, bottom line, science is real, viruses are real. There are certain rules that you can do to take care of yourself and your fellow protesters, and they are stay socially distanced, wear face coverings to protect each other, not to protect yourself, and almost most important, take this seriously. Treat it with care and intention so we don't have another 100,000 dead Americans in the next few months. Thanks.